Well, a very good Memorial Day Monday, which was a very good time for me to get my brother, renowned cancer surgeon, Dr. Anton Bilchik, on this podcast with me. So, Anton, first of all, it's always wonderful talking to you. And it's a holiday, which means I get to speak to you. So this morning, we're talking about the future of weight loss, medications, metabolism, and medical breakthroughs. Now, we know that obesity is a chronic disease. Let's talk about that for a moment and why obesity is such a problem for the medical fraternity.
Obesity is an epidemic. There are so many people in the West, particularly in the United States, that are overweight and are considered obese. And the reason it's so relevant is that it's probably the single highest risk factor in terms of getting cancer and heart disease. And there's therefore been such a big emphasis on weight loss and lifestyle. And studies have shown that weight loss and lifestyle reduce the risk of getting cancer, reduce the risk of getting heart disease. So it really is one of the most important preventable factors in terms of reducing heart disease and cancer.
And yet, reducing weight is such a struggle for so many people. And along come these apparently wonder drugs, which are semaglutides and tirzepatide. In your opinion, and now that we are well into understanding the efficacy of them, what are your thoughts?
Well, I think it's important to understand the background, and it's important to understand why these drugs are so important, and why there are so many more drugs that are coming down the pike that may be even more effective. So prior to the availability of these drugs, all we had was weight loss through lifestyle and calorie reduction. And the recommendations were to reduce calories to 500 to 600 calories a day and exercise 150 minutes a week. People would lose maybe 2 to 5% of weight at 12 months. The problem is that the majority of those people would regain their weight because actually their appetite increased after going through this process of weight loss and increased physical activity. And the reason is that as people would lose weight, the metabolic rate would come down. Okay, the metabolic rate would come down, and then the metabolic rate after about a year or so stays down, but your appetite increases. So your metabolism is not causing you to lose weight, and so that's why so many people would regain their weight. And there's a very interesting report. Remember the show The Biggest Loser?
Sure.
So in that show, people were taking 610 calories a day. They lost about 40% of their body weight. And so the show was so impactful. The problem is that at 6 years, 2/3 of them had their weight come back. And we never really
explained so well. Metabolism slows down with calorie reduction.
And that's exactly it. So the metabolism would slow down, but the appetite came back up. And so unfortunately, 2/3 of those people that lost massive amounts of weight regained their weight. So that has led to really, the development of newer drugs that could make weight loss sustainable. And we really have not had effective drugs. We've known about bupropion, which is an antidepressant, fen-phen. All these drugs are, have been readily available. Naloxone have been available and have been tested and been shown to lose weight, but they have side effects. And then these peptide agonist drugs became available, and they've really been a total game changer in terms of not just weight loss, but potentially cancer prevention and cardiovascular disease prevention.
So if you're watching or listening to us and you are on the fence, you're going, I have X amount of weight to lose. Let's talk about your options, because you also speak about, at some point, bariatric surgery was a way of helping people who had, let's say, up to how much weight to lose.
Yeah, so that's very important, because bariatric surgery is still a very effective form of weight loss and has been around for a long time, and still results in the largest amount of weight loss. So there are studies that have shown that people can lose up to 40% of their body weight for a long period of time, and that results in less cancer and less heart disease.
So let's talk about bariatric surgery. Does that also mean, because you've had the bariatric surgery and your capacity to eat is diminished, does that mean your metabolism slows down as well? I think you explained that so well earlier on.
Correct, but the way bariatric surgery works, and most bariatric operations now are called a sleeve gastrectomy, where the stomach is made smaller, or what's known as a Roux-Y bypass, where essentially the stomach is bypassed. And so the way it works is actually very interesting. Not only do you have less of an appetite because your stomach is significantly smaller, but these GLP peptides, or the drugs that are based on the GLP-1s, actually go up, which are appetite suppressants. So they've shown that those are the mechanisms of weight loss with bariatric surgery. And bariatric surgery has definitely dropped significantly in this country because of the availability of these drugs. And there probably is still a role for people that are significantly overweight, because you do lose more weight with bariatric surgery than these drugs. But having said that, now with these newer, what are known as dual agonist drugs, the tirzepatide, results are showing that you may lose as much weight taking some of these newer drugs as with bariatric surgery.
So again, if you are on the fence and you're going, how much weight would you say? I mean, is there a pound amount? Is there a body mass index amount that you start considering drastic measures? Because we do know that some people go, oh, I have 5-10 pounds to lose. Let me try a GLP-1. Is that the best use of it? At what point do you go, I need to listen to Dr. Anton Bilchik?
So let's just dissect that a little bit, because that's a very complex question. So right now, the GLP-1 agonists are approved for people that are considered obese and are diabetic. Okay, it's important to understand that these drugs are not approved for people trying to lose 5 or 10 pounds. And so this is where the doctor has to make a decision that not only is my patient overweight, but the chances are, if they lose weight, their diabetes may go away, or may be better treated. That is what these drugs are approved for. Having said that, because we're learning that these drugs are powerful medicines in terms of preventing heart disease, potentially, and reducing cancer risk, there are large trials going on with particularly tirzepatide, comparing, and these are not patients that are only obese and diabetic. These are just obese patients looking at the long-term effects just treating obesity. So the indications may change down the road because of what we're now learning, that these drugs may have not just an effect in reducing appetite, not just in terms of stimulating your metabolism, but also can have an anti-inflammatory effect, which can be beneficial in heart disease, which can reduce the risk of getting cancer, and can also have an effect on the bacteria in your body, the microbiome, which we've spoken about before.
About microbiome extensively. So again, for people who haven't heard your explanation, I think it's brilliant. And just a reminder, we do this podcast, we have these conversations to try and help you unpack the plethora of information that we are bombarded with. So I'm understanding that now GLP-1s should be accompanied by something to assist the positive gut biome, correct?
Right. So let's just, again, understand these GLP-1 drugs should not just be handed out or bought on the internet without, any oversight, simply because they're not without their side effects. And there's data that shows that if you start a GLP-1 agonist drug, you're going to have to take it for the rest of your life. And these drugs, we've seen people show up in our emergency room with horrible stomach issues, gallbladder issues, pancreas issues as a result of these GLP-1 drugs. And many of these patients are not overweight. So it really is important to have a physician prescribe these drugs, but also to have a team of people, which usually involves a nutritionist, state how important exercise is, lifestyle, therapy. I mean, everything. It's not just about the drug. It's not just about the drug. So the greatest beneficial effect is a combination of everything, but selecting the right person to take the medication. If you can do that, the results have been truly outstanding. And what's most important about these drugs is that the weight loss effect is durable, but it has to be managed. And we don't know if people can go off these drugs. And that's why one has to be enormously careful. The dosing is also important. And so to think that every physician knows how to dose correctly, I mean, this has become a specialty field where there are physicians that literally deal with, metabolism issues and weight loss, and are monitoring these patients very, very carefully in terms of how to dose, how to increase the dose, how to decrease the dose, when to give people a break. So this is one of the most exciting fields in medicine right now. And we looked at. I mean, I think what's important about our discussion today is that you and I looked at some of the most recent studies. So our discussion is really evidence-based rather than my opinion. I mean, I'm a cancer surgeon, but this is enormously important to what I do, because if we can reduce the risk of cancer through medications like tirzepatide, that's enormously important. And one of the studies that we looked at that came out of Israel compared bariatric surgery to GLP-1 agonists, and the bariatric group lost more weight than people taking GLP-1 agonists. But what was so important was that the cancer reduction in both groups was the same. Why is that relevant? Because the thought was that if you lose weight, you have less chance of getting cancer. Well, here you have the patients taking GLP-1 drugs who lost less weight than the bariatric groups, but at the same time had the same reduction in cancer. And that would suggest that these GLP-1 drugs work in another way to reduce the chance of getting cancer or heart disease other than just weight loss. So that's a very, very important finding. And the hypothesis, again, as I mentioned before, is that it may have an anti-inflammatory effect. And that's become the big buzzword for heart disease and cancer these days.
Now, the barrier to taking these drugs, of course, is cost. And one of the things the study looked at is there going to be a time that these drugs will be less cost prohibitive?
Oh, I think there's so much pressure right now to reduce the cost of these drugs. They are enormously expensive, and I think it's become very controversial because in some countries these drugs are significantly less expensive than in the US. So some people are literally crossing the border to Canada or going to Europe to buy these drugs and then bring them into the States. So the cost clearly needs to come down. But again, one of the issues that we're seeing is that these drugs are also being abused. I mean, we know so many people that take these drugs to lose 5 pounds because they've got an event coming up, a wedding, a graduation, and so they just get someone to prescribe these drugs, pay a couple $1,000s a month, lose 5 pounds, and so it goes. And so I call it recreational
yes.
Ozempic.
Microdosing of Ozempic.
Yeah, and I mean, it's now I say that with tongue in cheek, because what happens if with all these studies that are going on, what happens if these studies show that so we're not talking about obese patients. What happens if these studies show that people that are at risk for getting cancer or have a risk for getting heart disease because there's a genetic, they have many members of their family that have heart disease, that these drugs can prevent you from getting heart disease or for getting cancer, but you're not obese. We're not there yet. We are not there yet, but certainly when you start looking at some of these newer compounds like tirzepatide, and I was talking to Brian, our brother, who's a cardiologist in Boston and works out of the Brigham Hospital yesterday, and he was saying, I mean, he does a lot of prevention of heart disease work, and he was telling me that cardiologists are really interested in this drug tirzepatide because they are seeing how effective it is in reducing the chances of getting bad heart disease.
So for those of you who have just joined us, I'm talking to my brother, renowned cancer surgeon, Dr. Anton Bilchik, and we're talking about weight loss drugs and really the concept of, do you combine weight loss drugs with other therapies, and about gut biome and how important that is. So all the things that go into living longer, living stronger, and living healthier. Anton, as far as the future, one of the questions that's come up, somebody's asked this: what emerging therapies or combination treatments are on the horizon that may further enhance weight loss outcomes? Do you feel you've answered that, or it's worth repeating?
So, just a funny story. I'm sure you remember that when I came to the United States, I did my PhD at Yale, University, and a lot of the research that I did, in the late 1980s, was on glucagon and peptide YY. I was in a peptide lab, and so we were running all these assays and studying the role of glucagon.
What does that mean?
These weight loss drugs, I mean, GLP-1 is glucagon-like peptide 1. So I was studying the role of glucagon. Of course, we had no idea, but that is how I spent 3 years. And the reason it's become even more relevant to answer your question is, we're learning that glucagon-like peptide 1, which is GLP-1 agonist,
is that Ozempic?
That's Ozempic.
As
Okay.
opposed to Mounjaro, which is
those are all GLP-1 drugs. Okay.
Ozempic is the different one.
Right. And so those are called GLP-1 agonists. So they purely are, there are drugs that impact the glucagon-like peptide, which suppresses,
which you who are joining us,
right, which reduces your appetite, and that's the way it works, and it delays the emptying of the stomach, so you feel full quicker. That's the way it works. So in comes what are called dual treatments, right? Meaning more than GLP-1. So we've got, let's just say, Ozempic plus another drug combined. Mm-hmm. So it's called GLP-1 and GIP, which stands for glucose-dependent insulinotropic peptide, GIP. So now you're taking 2 of those, and that's tirzepatide, right? So tirzepatide has been compared to the single agent drugs like Ozempic, and shown to not only result in even more weight loss. So now the weight loss that you're getting from these dual agonist drugs, not only is it more effective in terms of losing weight, but it's also getting close to the amount of weight you lose after bariatric surgery, and it has the beneficial part of reducing the risk of heart disease through another mechanism that is still being examined. And then we get, and now several other gut hormones are being looked at, and one of them, and that's why I started off telling you about my experience at Yale, is PYY, which stands for peptide YY. When I was doing research in peptide YY and glucagon, we ran so many assays and we ran so many experiments back then, but obviously had no idea that these drugs, or the action of these types of drugs, would be appetite suppressants. But there are a host of new gut hormones that are being studied right now, and we're going to hear more and more about them. And some originate from some originate from a certain part of the small intestine. Some originate from the duodenum, which is the first part of the small intestine. And so within the next 5 to 10 years, there may be 15 different weight loss drugs, and different people may respond differently to each specific drug.
So let's do a summary at this point. If you are considering a weight loss drug, if you have a significant amount of weight loss needed and you have tried everything, and I think your explanation at the beginning of this conversation was brilliant, which is you reduce calories, you slow down your metabolism, then the hunger comes back, and that's why weight loss is not sustained or sustainable for so many people. So break it down in very simple terms for us. You are going to your doctor because you are considering one of these drugs. What are the questions you should ask?
Well, you'll notice I didn't directly answer your question about how you define obesity.
Yes.
In terms of, because the patient that is likely, in fact, will benefit from these drugs is someone who is overweight and diabetic, and has tried lifestyle changes, and has tried various different calorie reduction programs, and has tried exercising regularly. Those people are after seeing their physician and really putting a lot of thought into it, will benefit, from these drugs. I think one of the challenges is it's not just about the drug.
Yes, that's the point.
It's not just about the drug, and that's why the doctors that do this routinely work as a team with nutritionists and psychologists, and encourage exercise. If you do everything, because a lot of people that are obese have struggled for long periods of time with this roller coaster ride, lose a few pounds and then going back up, and it's and it does affect your psyche, and suddenly you're taking a medication and you're just dropping weight, and the interesting part to that, you'd think that everyone who's just dropping weight enormously is happy.
Oh, that's a myth, isn't it?
It's a total myth, right? I mean, not everyone who's just,
It's interesting you should say that, because I remember speaking to somebody who had bariatric surgery, and she became very depressed because food was such comfort and food was such a source of joy for her. And that being taken away left her actually feeling very depressed. She did have to work with a psychologist, because often food becomes the one thing that's so comforting, and now your capacity to eat is diminished, takes away some joy. And also certain foods release certain hormones and feelings, right?
Well, there are studies that have shown that massive weight loss after bariatric surgery has a higher risk of depression, has a higher risk of suicide, has a high risk of osteoporosis. And that's one of the reasons that these drugs are being looked at as opposed to bariatric surgery.
So if you had one message, I know it's a lot to ask of you at this point, but if you have one message about all of this, and I've got data and I've printed out everything you sent me, and it's copious. There's so much research and so many things, but I'll go through what the key questions were. Can medications help close the gap between diet and surgery? What are the cardiovascular benefits of these treatments? And what does the latest research tell us about long-term effectiveness? And I think you've really answered all those questions. So I'll make sure that this conversation is available for people who want to listen, watch from the beginning. Is there anything you want to add to that? Because all of our conversation today is based on the latest research and data.
I just think that this is one of the most exciting, important areas of medicine today. Everyone's talking about it. And I think the key point is that these are, some of the most effective drugs out there to help people lose weight who have struggled with weight loss and who are going down this path. It's not just about being overweight, but having heart disease and getting cancer. But these drugs are also being abused, and so my message is, by all means, go and see your doctor if you have struggled with your weight, and see if you're a candidate for one of these drugs. But taking it to lose, 3-4 pounds is potentially dangerous, because you also lose, you get body distortion, and you start becoming almost addicted, and you get to a point where how much weight loss, if you lose 3 pounds, well, maybe I should lose 10, 15, 20, and you lose all sense. I mean, you see some people walking around who've just lost massive amounts of weight, and they're so thin, and they're continuing to take these medications because they're so concerned about gaining 1 or 2 pounds.
And then you lose muscle as well, I would assume.
Correct. And that's why I just, while I'm, the studies are just exploding in terms of the benefit of these medications, I think there is a real word of caution to a lot of people out there that are taking it, as I say, recreationally.
Well, I want to thank my brother, cancer surgeon, Dr. Anton Bilchik. I get to have these wonderful conversations. Anton, you have taught me so much through all our conversations. I didn't know what microbiome was before we started speaking. So for this week, because Monday is a good day to start, and especially since it's Memorial Day Monday, it's a good day to start doing your 20 minutes of exercise a day, having things that improve your gut biome. And Anton, there's so much out there. There's so much literature, isn't there? So what is your message to yourself for this week to live long, live strong, and live healthy?
Well, I did my first 10K race yesterday in a long time.
Miles.
It's about 6.2 or 6.3
That's
miles.
remarkable considering you had some health challenges, right?
Right. So, for me, that was my challenge. I hadn't, done one of those in a while. And, and then some stretching and exercise and, eating healthy today and maybe just relaxing. And we've spoken about, stress reduction and how important it is just to take some time just to, get that heart rate down, just relax and not feel guilty about it.
Well, I often think about Brene Brown saying it is not joy that makes us grateful, but gratitude that makes us joyful. And the power of gratitude on one's both mental and physical health is enormous. So, and can I always end by saying I'm so grateful. I'm trying to get Dr. Brian Bilchik and Dr. Tanya Bilchik, our other two siblings, to talk about both neurology, impact on headaches, and cardiovascular health. But in the meanwhile, it was fantastic that I got to speak to you, and wishing everybody a rest of a very thoughtful and meaningful and maybe productive Memorial Day. But most importantly, it's so important to stay healthy. And health, as you've said time and time again, is mental and physical. So thank you for your insight and the research. I've still got papers, but I learned a lot today. And I hope each and every person listening, watching did too. And thank you for joining me. Bye.
Thanks, Nat. Bye.